I do a variety of things. Right now I'm being the veterinarian, so I am responsible for taking care of the physical care of the animals here. I have vet checks that I look at every day. These are medical exams I have to perform on the animals in the shelter. I'm responsible for overall health of the shelter, which means I am responsible for taking care of disease on a more global scale and looking at how the population is doing as a whole. And this makes it very difficult because we have animals that are really a herd, but we also want to look at them as individuals. When I'm not doing those physical exams, I'm doing surgery normally. I do all of the neuters and spays that come through the shelter. Every animal that gets adopted has to have a neuter or spay surgery. I have a wonderful surgery assistant who helps me do that every weekday, and we spay and neuter. We try to spay and neuter every animal that we have available here. So that's that part of my job. We're getting a new executive director, but more recently I've been helping with some of those duties, and a lot of that involves going out into the public and speaking to the public about what we do at the Lawrence Humane Society.
How many animals do you treat on average per day?
Well, that's kind of hard to say. Today I have 6 pages of vet checks, and we have about 7 to 10 dogs that we have to spay and neuter, and we have probably a few cats as well. I have some fosters that I have to look at, and most of the time during the day I get interrupted several times to look at special cases that come through the shelter, so it's quite busy most of the time, especially in the summertime. Just to give you an idea, we get about 3,500 animals coming through this shelter every year.
How many of those animals are brought in by animal control?
Approximately a third of the animals that we get are stray. Or half, maybe. I'm not sure about that number. I don't have the statistics in front of me right now. But it's a sizable number. And they bring in animals every day, and we take care of them. And we have a contract with them. One thing that's important to note is that we are not funded by the city or the state or the county directly. We do not receive tax dollars for what we do. We have a contract. We're independently contracted with the county and with the city to take care of the stray animal population for the first 72 hours that they're here. And that means that the funds that we get from them only cover 72 hours. After that, all of the money that we get, all the money we need comes from individual donation. This is really important because some people have this impression that we are run by the city or run by the county, and that's not true. We're run through donation. And we need people to know that because we need people to help us donate and to help us take care of the animal population the rest of the time. Our length of stay is probably a minimum of 10 days, and so we're only getting the first 3 covered through our contracts with animal control. The other 7 come from donations and grants.
If you don't mind me asking, how do you treat the animals brought in by animal control?
We give them the best care we can. We treat them all the same. We, when they come in, they get vaccines on intake, they get assessed, they get a medical exam. We identify any problems that they have, and then we start them on treatment if that's warranted. We also deworm them and kind of assess their temperament as well at the time when we take them in, too. We try not to put dangerous animals in an area where the public might view them. So if they're really aggressive, they might have to stay back in our isolated area.
Where do your donations come from? Are they anonymous or do charities?
We have a large donor database, and most of the donations, I would say, come from the community of Lawrence and from the people of Lawrence. So we'd like to thank all of those wonderful people. We do have some anonymous donations, and then some of the grants that we get, we have to apply for. They require that we meet certain criteria, and those vary from grant to grant.